follow all the things which has been prescribed, but I have been giving the medicine, the supplements which were prescribed for him. The drastic improvement I could see in him is the language, the communication, because before he was not able to, okay, to a certain extent he could speak many things, but right now he can speak, and even he has he could speak only our mother tongue, that is Manipuri, but now he is speaking in English as well as Hindi also. And in the language, because he started arguing also, like if I say something, then he will reply back, and argument in the sense that replying back, that if he doesn't want that, he'll keep on arguing. So this is a kind of improvement I can see. So in terms of language, I see a drastic improvement in him. So overall, I'll say that it has been a very useful session we had, because many things which we did not know, we came to know of it. And so in the long run, if we continue doing this, I hope that the improvement will be gradual. And since it has been happening since a long time, I don't think that it can be corrected all of a sudden. Every child is unique.
इम्प्रूवमेंट्स फर्स्ट तो ये है कि अगर अभी क्या है इंटरेक्शंस होता है, फर्स्ट थिंग ये है कि सपोज पहले क्या था, कुछ रिस्पांस नहीं मिलता था, सपोज कुछ सामान लाने के लिए हम लोगों ने बोला ब्रिंग दिस, वो कुछ भी रिस्पांस नहीं देती थी. अभी थोड़ा इम्प्रूवमेंट बोलते हैं 20%. सेकंड ये है कि पहले सोशल इंटरेक्शन उसका कुछ भी नहीं था, बच्चा लोग खेल रहा है इवन दो दे आर इन देयर होम, ओके, वो कुछ भी रिस्पांस नहीं करती थी. अभी थोड़ा है कि एक दो से थोड़ा सा उसका टच हुआ है, एक दो बंदे से बच्चे से उसका टच हुआ. सो यू कैन से लाइक देयर सम इम्प्रूवमेंट इन दैट सोशल इंटरेक्शन आल्सो. फॉर मिलेट्स वी स्टार्टेड लाइक 10 days 2 weeks बैक, और अभी वो लोग वो मिलेट्स एटलीस्ट डे में एक बार खाती है, बाकी टाइम तो मतलब पॉसिबल नहीं है, लेकिन हम लोग अभी उसको हैबिटेट कर रहे हैं उसके लिए.
My child was COVID infected, so थोड़ा सा मेरे को impact पड़ा था for 3 weeks, but then nevertheless I should say improvement है child में. So I'm not too bothered about the speech because that is something last that will come, which I understand. And as much as we are echoing and doing mans with him, imitation practices with him, it's all improving. It's just that I see improvement in the gut balance. Earlier he was highly constipated, but now he has improved a lot. His digestion has improved, diet has improved, hyperactivity is controlled, the response has increased. So these are the various things that I have seen improvement.
Regarding the improvements in Manav's this thing, we have noticed a peculiar improvement in his eye contact, the stereotypical behavior, or you can call as hyperactivity, has been reduced to some extent.
Ayush and Ashwini sir, absolutely, I'm very, very thankful to you for bringing out this wonderful program. And we would say that we are benefited with this program, and my son is, considerably have improved from past. Everything, his bowel movements and his hand clapping has came down. Hyperactivity has came down, and his digestion is also very good, better than before. So I would say that he is doing well.
Supplement and जो डाइट दिया गया था वो फॉलो किया है 2 मंथ के लिए, अभी तो 1.5 महीना हुआ और इम्प्रूवमेंट दिख रहा है में. वो स्लीपिंग का उसका प्रॉब्लम बहुत पूरा, पहले चीजें समझ नहीं रहा था, अभी समझ रहा है, थोड़ा आई कांटेक्ट बढ़ा है.
देखा है कि हंसिका में बहुत सारी चीजों में इम्प्रूवमेंट्स हुई हैं, जैसे कि उसका इमिटेशन इम्प्रूव हुआ है और अंडरस्टैंडिंग इम्प्रूव हुआ है, कमांड फॉलोइंग भी मतलब पहले से काफी बेटर है, नेम रिस्पांस भी अच्छा हो गया है, और सबसे बेस्ट पॉइंट मेरे लिए ये है कि इसका डाइजेशन इम्प्रूव हो गया है. जो मतलब इसको डेली बेसिस पे मुझे कॉन्स्टिपेशन का प्रॉब्लम फेस करना पड़ रहा था ना, वो चीज मेरे लिए बहुत ही एक रिलैक्स देने वाली चीज है. तो लो पॉइंट है वो इम्प्रूव हो जाएगा, तो शायद इसलिए मतलब उसका बाकी चीजों में इम्प्रूवमेंट हुआ है. स्पीच में भी मैं कहूंगी कि मतलब जो बिल्कुल हमेशा साइलेंट मोड पे रहती थी, अब वो चीज नहीं है. मतलब कुछ मतलब मीनिंगफुल नहीं है चीजें, लेकिन कोशिश करती है कुछ कुछ बोलने के लिए। बाकी ओवरऑल मैं यही कहूंगी कि आप लोगों का जो ये सबसे बेस्ट पॉइंट था, मतलब बच्चों को लेके कि जिस चीज की बच्चे में डेफिशिएंसी है या जिस भी प्रॉब्लम की वजह से बच्चा ऑटिस्टिक हो गया है या फिर ADHD का प्रॉब्लम है बच्चे में जिस चीज की कमी है उसको रूल आउट किया जाए चाहिए। वो चीज मुझे सबसे अच्छी लगी और उसकी वजह से मुझे मतलब बच्चे में काफी इम्प्रूवमेंट लगा है।
Yes, at all. Recently, I changed his school, but he has taken it very beautifully. And उसका जो communication है वो भी अच्छा रहा. He has improved a lot. Even earlier, he didn't like to study at all. Nowadays, he is very eager to do his maths and all other things. So,
for the last couple of months, there is an improvement. How much improvement? Overall aspect, I would say 20 to 30%. So that is a lot. In our country, what I know is there are therapies, occupational therapy, speech therapy, physical therapy, or you name ABA therapy. What they do is, gaadi aaye to you have to stop. That's what is trained. But like a dog is trained, but at least this innovative idea from Dr. Ashwin is laudable. And coming to, for example, my son is having a milk protein allergy, so that is, but after joining this because of medicine or whatever it is, his IgE was like 1150, now it has come down to 843. There is a lot of improvement, so we have a hope. What I wanted to say is we have a hope. He started communicating with them, he or she. He says, hey, how are you?
Changes I like mostly I attracted is due to the lifestyle changes like sunlight, water. Those were, now nobody will say like that, like Dr. Ashwini sir told. Those were very easy autistic. He is so much improved, sir. Imitation skills were improved, communication skills were improved. He's completely mute. Now he started words. And next one, he used to pass 3 times rules every day. Now he's passing only single time. That one is improvement. He used to be lethargic, sir. Now he is active.
So the reason before starting the session I wanted to share this is because all of us, we need positivity, and all of us, we need hope. Now, these are exactly the kind of problems that you have mentioned while you were polling. If you saw or if you notice, there are different kinds of, you talked about speech, bacha bol nahi pa raha hai, ya bacha kam bolta hai. Bacha learning disability, somebody mentioned learning disability. How do we make him learn and understand the curriculum better? So there are people who have started doing maths, for example. There are behavioral issues. Children are walking around and doing some stereotypical hand flapping करते हैं कुछ बच्चे और करते हैं. तो ये सारी चीजों के ऊपर massive improvement है. So all of these situations can happen, and this is a result of only 2.5 months of implementation of what we are going to suggest. So it is important. मैं दोबारा से आप लोगों को request कर रहा हूँ कि आप में से बहुत सारे लोग you would be part of different kinds of groups and all of that, wherein a lot of suffering parents are there. So a simple request to you guys, I'll share that link again with you guys. So please make sure that you share this in your community so that basically others are also able to join this session and gain why this is happening, how this is happening, what you can do in your environment to make this happen for your own child. So in सारी चीजों के लिए we have shared that link with you. So I'm ending this poll. I'll just throw it out for all of you guys to see. ज़्यादातर लोगों को ADHD का प्रॉब्लम है, ऑटिज्म का प्रॉब्लम है बच्चे के साथ. 40% of you are having different kinds of ADHD का इशू है, ADD इशू है, GDD की भी प्रॉब्लम है. All of this is there, hypotonia, etc. All of these problems are there. Now, all of these problems can be understood very well why exactly those problems are happening, which is what a lot of people mentioned as root causes. वो root cause अगर हम पता करते हैं, if we are able to identify, understand the root cause, then we are able to simplify the problem, break the problem into many components and resolve those components. So this is what we would be talking about. So welcome all for in our session. So we'll just begin our session. My name is Ayush. I'll be your host tonight, and we'll be talking about functional medicine approach for developmental disorders. Now, first things first, what is functional medicine? Functional medicine is a methodology, it's an approach, it's a modality, much like how Ayurveda is, homeopathy is, allopathy is. Functional medicine is a different modality which helps us understand the biochemical pathways. Our body is a combination of different biochemical reactions happening, which is a chain of reactions. Khana khate hain, when we eat something, it breaks down into micronutrients, then hormones and enzymes, and different organs function. The brain develops, different centers of the brain they develop, taste buds they develop, and that's why children are hypersensitive and their taste buds are not getting fully developed, which is why they are fussy eaters, because they don't find the food to be safe. Why it is happening could be understood and it could be resolved. All of these things we will be discussing. So ये सारी चीजों को समझने के लिए functional medicine is a wonderful approach wherein we can reach the root causes of the different conditions which the child is suffering from, and thereby create a path towards success, towards recovery, towards a complete recovery also in many cases. There are several cases wherein children are non-verbal, they are 19 years old and so on, and they have started speaking. So all of those examples, children who are never speaking, they have started recording songs. All of this is possible. Now, some of you who are not able to hear us, we are also live on Facebook. We will be sharing Facebook live link very soon. And please make sure that you tap onto this headphone icon and then call over internet. Please make sure that you do that so that we are audible to you. Nidhi, please type in that message if you can. Tap onto headphone icon. Okay. Otherwise, still, if you are having, we'll be sharing Facebook live link very soon. So in a minute, we'll be sharing. So this is how it is now. When we are talking about any kind of a developmental disorders, there are two things which are told to you by different experts, all kinds of experts, or else you choose your own path. Either you go for allopathy, homeopathy, Ayurveda. This is medicines. Yes, Neelam will talk about mood swings also. Hormones also have a strong role to play there. So we'll talk about all of that. Facebook live link has been shared with you. So all of these medicines, there is no evidence yet that there is a medicine for, let's say, mood swings. Let's say being a fussy eater. There is no one pill which has been manufactured, whichever be the methodology. So it might work for you in some cases. It may not work for you in some other cases. It's much like placebo, but in some cases it is effective. But so far there is no evidence. The other thing that has been told to you is about therapies. Everyone advises you about therapies. What is therapy? Therapy is repetition, or again and again your child is subjected to, if you have to sit in a certain way. एक तरीके से बैठना होता है. अगर किसी से हाथ मिलाना है, if you have to shake hand, you have to do it in a certain way. Now, because you repeat it 10,000 times, some children, they are able to grasp something and they are able to regurgitate. वो दोबारा से उसी चीज को वापस कर पाते हैं. तो इस वजह से they learn a certain thing. But is it curative in nature? The response to this would be questionable. Again, it is not the scope of therapies. Therapies are being nice to your children so that you can help your children. It's not a bad thing. It's helpful, of course, but it's not curative in nature. So the question is, are we looking in the right direction? Are we, when we are trying to help our child to the best of our ability and applicability, are we looking in the right direction? Is there something else that we should be doing? To answer all of these questions and to help your child become real, become himself, become complete in whatever capability naturally has been bestowed upon him, उस हिसाब से क्या कर सकते हैं, कैसे कर सकते हैं? Yeah, again, Jimmy, the same thing. Not chewing, swallowing is the same thing. Not feeling safe, hypersensitivity and taste buds, two things. So you have to enable your child to become completely real. So for this, we have a wonderful program. Dr. Ashwini Garg is our expert for developmental disorders. So he is not just a doctor, he's an MBBS basically, and he is a functional medicine expert. But not just a doctor, he is also an educator, he is an author, he's a speaker, he's present in several boards and several forums and so on. He does a lot of wonderful work around a variety of conditions, autoimmune conditions, GI issues, and so on. But his main area of focus currently is child intellectual disorders. So without further ado, I would want to invite Dr. Ashwini to please take over and guide us further.
Hey, hi, Ayush. Thank you so much for giving me the opportunity to share my thoughts with the audience. And I hope I'll be useful and share something which they can implement and improve their child. So yes, thank you so much again for setting the right context. You know, all of us are born for a purpose, and we should be able to do that. So any child having some difficulty with all these conditions, they can still get better. Okay, there's a lot of hope and a lot of things can be done. A lot of things can be understood and can be fixed. So these guys are born to be real, and we can certainly help them get better. So we deal with autoimmune problems, metabolic issues, GI issues, and of course intellectual abilities to improve them. Now, to have a healthy body, there are fundamentals. Okay, I need to have a healthy immune system, healthy digestive system, and healthy metabolic system. If I get that, my body will function better. Okay, so generally, we get stuck to, oh, this is a brain disorder, it cannot be dealt with the brain medicine. No, if your body is healthy, brain will function well. If your body is not healthy, brain will also not function well. So at the end of the day, it's a whole body approach. It cannot be just looking at the one organ or this organ, that organ. Now, most of the time, when your child is diagnosed, as a parent, you're always in a shock and you're looking for answers. And you go see a doctor, you are told that it is a genetic problem. That's a big issue that, that puts onto a very, very negative state of affairs. Now, you see, 30, 40 years back, probably one child out of 2,000, 5,000 will have this problem. Today, almost one child in 150, 160 is having a problem. So problem has gone up, number of cases gone up exponentially. At the same time, in last 30, 40 years, there's no such thing that human genome have changed. Now, if there's no change in the human genome, how can these many kids are born with a genetic problem? So certainly, I believe it is not just a genetic problem, but fact of the matter is this problem is actually an epigenetic problem. You have a genetic makeup and you have an environment controlling your manifestation or your function of the genes. Now, if you don't have a right environment, then also genes will not function better. This is where a problem or a manifestation start happening in terms of a lot of symptoms. Now, you see, it is not a genetic problem. Genes have not changed in the humans in the last 30, 40 years, but certainly the environment that we are living is tremendously has changed. Now, that bad environment, we can talk about it, has led to the problem, has influenced the genes to have this behavior. If we change the environment back, the behavior can come to normal. So 80 to 85% of the cases, the child can become normal. A child can become diagnosis free. Okay, he can get back his abilities as long as we are willing to change that environment. So this is a very, very strong point, and a parent should definitely get that point, that it is not a genetic, but it is an epigenetic problem. And all of you can work towards solving that problem. Another thing about autism we have to understand, it is just not a brain disorder or a genetic disorder. It is actually a whole body disorder. If the stomach is not well, if immune system is not well, if metabolism is not well, if detoxification is not happening, this is impacting the brain, leading to the symptoms. Not that there's something wrong in the brain. You see, the moment you start improving the immune system, gut function, detoxification pathway, you see that brain, the child started behaving, learning better. So it is second very, very important point. Everybody should understand that it is a whole body disorder. Now, a child with autism, ADHD, ASD, different diagnoses with different names, but at the end of the day, few common things. There's a poor communication, poor speech, poor socialization, and hypersensitivity and repetitive behavior. Now, along with that, you always find there are gut issues. 80 to 90% of the kids have gut issues. Many of these children also has allergies and other concomitant issues. Now, this is not just a coincidence. A large group of these people have a stomach problem. And the good news is when we start improving the stomach, the brain also start improving. Okay, so we have to understand how the body works and how it is impacting the brain. So just on harping on the point of genetics, genes can load the gun, but environment pulls the trigger. There might be a snip in the child. There might be a little bit of a here and there some issues in the genes, which if they are there. But at the same time, genes are not controlling it. It is the environment which is controlling the genes. So genes just load the gun, but environment pulls us trigger. So if we improve the immune system, if we improve the gut function, improve the detoxification, you see that the body starts functioning better. तो हिंदी में अगर मैं समझाऊं किसी को, सिर्फ जीन्स को ब्लेम नहीं करना है. एनवायरनमेंट है जो जीन्स से अच्छा या बुरा चीज करवा सकता है. इन्वायरमेंट कैसा लाइट, कैसा पानी, कैसा खाना, कैसा स्टमक के अंदर बैक्टीरिया, ये सब चीजें जीन्स को इन्फ्लुएंस करती हैं. अगर ये सब चीजें हम ठीक कर लेंगे, जीन्स अच्छे से काम करेंगे, अच्छा मैनिफेस्टेशन करेंगे और डिजीज चला जाएगा. अगर जीन्स अच्छा भी है लेकिन एनवायरनमेंट खराब है तब भी बीमारी आ सकता है. नाउ हम लोग जीन्स को तो चेंज नहीं कर सकते हैं, बट सर्टनली हम अपना एनवायरनमेंट, अच्छा लाइट, अच्छा पानी, अच्छा खाना, अच्छा माइक्रोबायोटा, अच्छा टॉक्सिन फ्री बॉडी कर सकते हैं, जिससे आपका बच्चे का फंक्शन इम्प्रूव हो जाएगा. वो धीरे धीरे बेटर होने लगेगा, स्पीच आने लगेगा, लर्निंग आने लगेगा. ऑल द सिम्टम्स, किसी पे बच्चे को अलग अलग चीजें हैं. All of these things can be addressed. Now, there are two ways of treating this problem. One is external therapies, that is a behavioral therapy, speech therapy. So many of them, and most of you are trying your level best to cope up with these therapies. Now, these are external therapies. Now, let's understand, if my body has dehydration, and because of dehydration, my brain is not functioning well. Can the therapy help me with dehydration and fix it? No. I have to improve my hydration to have my brain functioning well, if that is a problem. Therapy cannot help me in that. You see, so there are fundamental reasons why some child has a problem, and we have to fix it from within. We have to fix it internally. So we deal with internal therapies. We try to correct the problem rather than just changing the behavior. Behaviorist therapies are fine, but they don't really give you the solution. So I'm not against therapies, but I want parents to understand there's much more than therapies which we can do to have a significant outcome. Now, when your child was diagnosed with a problem, you must have wondered, why did it happen to my child? And when you looked around for the reasons, most of the time you're not even given any reason. You were told it is a genetic problem. But here's a list of the things which could have potentially triggered the problem in the child. Increased oxidative stress, dysbiosis, SIBO, small intestinal bacterial overgrowth, food intolerances, sensitivities, parasitic infections, very, very common. Elevated histamines, low glutathione, very common. Increased toxic burden, especially the heavy metal, lead, mercury, arsenic, cadmium, strontium. Many a times when we check these kids with heavy metals are very, very high in these kids. Genetics could be a problem, but many times it's just epigenetic factor. Many times when we ask the parent, how was your child? They say the child was doing well. The child was growing well. He or she was meeting all the milestones. Then some infection happened or some vaccination has led to the regression of the problem. Now you see, child was born normal. Then some event has led to the problem. Many of these kids, because they don't get enough sunlight, they are low on vitamin D. Vitamin D is critical for the immune function. Agar enough vitamin D nahi hai, तब भी ये प्रॉब्लम आ सकता है. A mother having less nutrition in the body can have deficiencies in the child leading to such a problem. अगर माँ ने अच्छा सा न्यूट्रिशन नहीं खाया तब भी बच्चे को ऐसा प्रॉब्लम आ सकता है. If mother was on folic acid consumption can also cause this trouble. It should be folate which a mother should be taking during pregnancy. If a mother takes folic acid, which is a synthetic B9, that itself can cause the child to have such a trouble. Of course, detoxification, of course, mitochondrial function, of course, exposure to the radiation during pregnancy. So these are some of the reasons, and many of you might be able to correlate to many of these things, and those are the triggers for your child having such problem. Now, the good news is many of the things today also you can solve, you can improve, you can work upon them and improve your child's health. Okay. The first and the foremost, stomach has to be healthy, digestion has to be healthy, gut function has to be healthy. If we have to have a healthy body, engine of the body has to be healthy, stomach has to be healthy. To have a healthy stomach, you need to have a healthy bacteria in the gut. When we don't have healthy bacteria in the gut, then always we have a more unhealthy bacteria. That unhealthy bacteria can cause inflammation. That inflammation from the stomach can goes into the body, from the body goes into the brain, leading to the problem. Now, today, autism, ASD, ADHD, they are considered as an autoimmune problem. And this is caused by the inflammation, and it starts in the stomach. Agar stomach अच्छा नहीं है, brain को impact होता है. Deficiencies, allergies, and of course, xenobiotic, the accumulation of toxins coming from various sources. Could be the food, could be the water, could be the packaged foods, could be the air we breathe. Could be so many reasons जिसके कारण बच्चे के अंदर टॉक्सिन लोड बढ़ जाता है. ज्यादा टॉक्सिन होगा, माइटोकॉन्ड्रिया अच्छे से काम नहीं कर पाएगा, माइटोकॉन्ड्रिया अच्छे से काम नहीं कर पाएगा, सेल फंक्शन अच्छे से नहीं होगा, सेल फंक्शन अच्छे से नहीं होगा, अपना एक्टिविटी है, बिहेवियर है, लर्निंग है, कॉग्निटिव एबिलिटीज है, सब कुछ कम हो सकता है. एबनॉर्मल चीजें होने लगती हैं अगर सेल अच्छे से काम नहीं कर रहा है. Now you see, you can connect the dots. अगर स्टमक अच्छा नहीं है तो पूरा प्रॉब्लम सर्कल चल जाता है वहां से. Now functional medicine approach is not to give you another pill, not to give you another way of drugs, and it is all about trying to find out what's specifically wrong in your child. बच्चे को ऐसा behavior, ऐसा diagnosis, ऐसा symptom है क्यों? Why do your child have these problems? Then we take a corrective action. When I know this is the reason of your child's problem, then it becomes easy for me to correct that. I can change the food, I can change the nourishment, I can change the gut microbiota, I can change the environment, I can hydrate the body. So many things I can do when I know what is wrong. Now, when you don't know what is wrong, you just keep going into circles. You never get to the right point and start solving the problem. Functional medicine approach is all about knowing what is wrong. जब अपने को पता चल जाएगा ये खराबी है, तो हम solve कर सकते हैं. So you have to think differently. You cannot think in a conventional way कि this is a brain problem and you have to solve the brain. No, brain is impacted because of other reasons. वो अलग-अलग चीजों को अपने को solve करना है. Most commonly जो हम देखते हैं, there are so many deficiencies in these children. विटामिन ई कम है, ए कम है, जिंक कम है, सेलेनियम कम है, प्रोटीन्स आर कम. Specifically the serum creatinine. Serum creatinine is directly, low serum creatinine is proportional to the speech delay. अगर speech creatinine, serum creatinine कम है तो उन बच्चों में speech delay होता है. The moment we start feeding them enough proteins, they start getting better. Iron deficiency, folate deficiency, B12 deficiency, vitamin D deficiency, very very common. अगर कार में अच्छा फ्यूल नहीं है, कार फंक्शन नहीं करेगा. अपने बच्चे में डेफिशिएंसीज है तो वो अच्छे से कैसे डेवलप होगा, ब्रेन में नया कनेक्शंस कैसे बनेगा, कैसे वो लोग नया चीज सीखेंगे अगर उनको रॉ मटेरियल्स ही नहीं मिल रहा है. तो क्रिटिकल एस्पेक्ट ऑफ ट्रीटमेंट. सेकेंड इज, अगर अपने बच्चे को हम जेनेटिकली मॉडिफाइड खाना खिलाते हैं, GMO खिलाते हैं, which is not suiting to the humans. Today, so many of us are having problems just because we don't eat healthy, we don't stay in a good environment. we keep feeding our kids with genetically modified food, especially the wheat and dairy and the soy, that food can cause the trouble to the child. जब तक खराब फ्यूल डालेंगे कार में तब तक समस्या बना रहेगा, अच्छा फ्यूल डालेंगे कार चलने लगेगा, अच्छे से फंक्शन करने लगेगा. Same with the body. The moment you start feeding the good food, अच्छा खाना, अच्छा development, अच्छा brain development और अच्छा learning. So you always need to find out what is going wrong. In the beginning, I mentioned to have a good body, a healthy brain, we need to have a healthy digestive system. If we don't have a healthy digestive system, we cannot have a healthy body. Now, there's something called leaky gut. Your intestines are designed to digest the food, extract the nutrition, and throw the waste out. This is how our intestines are designed, our digestive system is designed. The moment the pore size into intestines becomes a little bigger, okay, that is called leaky gut. Unwanted toxins, undigested food particles, all unwanted things start getting into the bloodstream. Immune system gets red mark and it starts reacting to them. That reaction causes inflammation. Inflammation goes into the brain. Brain starts throwing the symptoms. Now you see, when we eat bad food, packaged food, not having good environment around it, that leads to leaky gut. Leaky gut leads to leaky brain, and there's a problem. So it's all connected. The moment we start fixing the brain, gut, the brain will start improving. So this something called brain gut axis. That brain is controlling the gut. At the same time, gut is also controlling the brain. That is called gut-brain axis. So there are so many trillions of bacteria, viruses, and fungi that is residing into the intestines. If we don't have good species in the intestine, and we have more unwanted species in the intestine, that imbalance is called as dysbiosis. That means we have more unwanted, less of wanted bacteria. When there's a imbalance, that imbalance can lead the gut not to function well. When we test these guys, many of these guys, they have dysbiosis. That means they have more unhealthy bacteria. Now, kind of bacteria, kind of byproduct go into the brain. If we have good byproducts from the bacteria, our brain will function well. Lot of good things like serotonin is produced by the gut bacteria. Now, if you have good guys, you produce more serotonin and you will be in a happy state of affairs. You don't have good bacteria in the gut, your child don't have enough good bacteria in the gut, they don't produce the good metabolites, they in fact start producing toxic metabolites. They can cause hyperactivity. So hyperactivity is linked to the stomach bacteria or a fungus in the stomach. So if we have to treat the hyperactivity, we have to treat the fungus in the stomach. Today, we are using so many disruptors in our diet or environment, which can disbalance our digestive system, also can disbalance our endocrine system. The cell-to-cell communication that happens through endocrine system can be disbalanced by the environment or things that are putting into ourselves or on the body. Now today, antibiotics, the child was doing well, there was some fever, you give an antibiotic and you see the child started regressing. A single shot of antibiotic can cause the trouble. Acid blockers, gluten, steroids, high sugar diets, food allergies, processed and junk food, those all can disrupt the digestive system. If digestion is not good, brain is not good. We put a lot of body lotions, sunblocks, pesticide, plastic, industrial chemicals, household chemicals, meat which is not organic, milk which is not organic. All these things can disbalance the natural hormone, endocrine system. Cell-to-cell communication is disrupted. This is where the problem starts. So if we have to have a healthy body, we have to avoid the negative things, start adding the good things to ourselves. This is a very, very important reason for kids not having a good health or a good brain health. That's a bad quality water. Many of you as a parent might be thinking your child is drinking more than enough water and is rushing to washroom again and again. These guys are more thirsty than they should be. They're drinking more than they should be, but they're still dehydrated. At a cellular level, when we look at the parameters, they are dehydrated. उनकी बॉडी में अच्छा हाइड्रेशन नहीं है, उनकी बॉडी में इनफ पानी नहीं है, उनके सेल में इनफ पानी नहीं है. Brain is 80% water. If we don't have enough water, our brain will not function well. Hydration is critically important. And when we feed ourselves with poor quality water, dehydration happens and symptoms happen. So right side, there's a structured water. Left side is the image of unstructured water. Today, we are all drinking unstructured water. The water has to be structured to hydrate our system. अगर पानी अच्छा क्वालिटी का नहीं है, स्ट्रक्चर्ड नहीं है, तो अपना हाइड्रेशन नहीं होगा. हाइड्रेशन नहीं होगा तो ब्रेन अच्छे से फंक्शन नहीं करेगा. सो दिस इज क्रिटिकली स्टेप. अगर हम पानी को सॉल्व नहीं करेंगे तो इट्स नॉट गुड. नेक्स्ट very important reason of so many cases of ADHD is non-native electromagnetic fields. We living in a technological world, but this technology has some benefits. At the same time, it's bringing lot of negativity to our health. Now, every device, every computer, every mobile phone has a light, unhealthy light, has an unhealthy electromagnetic field because of this machine. And this can disrupt the neurological system, this can disrupt the immune system, cellular health, repairs health, brain function. Because of the poor radiation that is there around us, that can make the child ADHD. Just to understand the gravity of that, a 6-year-old child's body absorbs 60% more radio frequency from a cell phone or other wireless devices than a person in their 20s. आपको मेरे को कम नुकसान हो रहा हमको भी है, लेकिन हमको कम है. बच्चों को ज्यादा नुकसान हो रहा है. आपने देखा होगा, आपका बच्चा ठीक था, नॉर्मल था, पेंडेमिक आ गया, आपका बच्चे का स्क्रीन टाइम बढ़ गया. स्क्रीन टाइम बढ़ने से उनको अंदर प्रॉब्लम चला गया. नाउ यू सी, यू कैन कनेक्ट द डॉट्स. जस्ट बीइंग योर चाइल्ड on the mobile phone all the time has given the trouble. Another concept which you should understand is non-verbal kids. If your child has a good memory, if your child can remember the visuals, that means there's nothing wrong with the child. It is just because of the exposure to the technologies, lot of visuals, lot of gaming, lot of memory that he's developed, but he's forgot to learn about the speech. If you take away the mobile phone, there it creates an ability or the opportunity to learn about speech. Now, when you don't create the right environment, this is where the problem starts. So ask yourself, is your child body, brain getting everything that they need to function? उनके अंदर enough protein है, उनके अंदर enough minerals, vitamins है, healthy fats है कि नहीं है? Does your child has enough raw materials for the body? Does your child have enough fuel for the brain to function normally? और उसमें कुछ missing है तो उसको ठीक करना है. Next question you should be asking is something is getting in the child's body or brain which is interfering with their ability to function optimally. कोई खराब रेडिएशन तो उनको ट्रबल नहीं कर रहा है, टॉक्सिन तो उनको ट्रबल नहीं कर रहा है, कुछ ऐसा खाना खिला रहे हो जो उनका हेल्थ को खराब कर रहा है, कुछ ऐसा पानी पिला रहे हो जो उनको हाइड्रेशन नहीं कर रहा है. So you have to start asking the right question. The moment you start asking the right question, there is a possibility कि आपको समझ आएगा कि कैसे ठीक करना है. Now, if you have to fix the problem, what is that we have to do? Important, critically important, you have to remove the toxins from the body. Their body is loaded with toxins. Aluminium, mercury, arsenic, lead, pesticide, all these things that are coming from the food, they interfere with the mitochondrial function. इंजन, आपका कार का इंजन में अगर कार्बन पार्टिकल जम जाएगा तो कार काम नहीं करेगा. वैसा ही माइटोकॉन्ड्रिया है. अगर माइटोकॉन्ड्रिया में टॉक्सिन्स है वो फंक्शन नहीं करेगा और सिस्टम इंपेयर हो जाएगा और सिम्टम्स आएंगे. अगर उनका खाना में इम्बैलेंसेस है, उनका न्यूट्रिशन में इम्बैलेंसेस है, मेक श्योर यू टैकल दैट प्रॉब्लम. अगर उनका बॉडी में इन्फ्लेमेशन है, मेनी टाइम्स 7-year-old kid, 5-year-old kid, their auto antibodies, ANA, anti-CCP, their CRP, many inflammatory markers, their homocysteine is quite high. Just being they are in an inflamed state cause the brain cell not to function well. The moment we lower their inflammation, they start functioning well. Gut bacteria plays a major role in the health. अगर अच्छा stomach नहीं है, अच्छा body नहीं है, तो you need to balance the microbiota. So these are critical things that we have to solve. Now, little bit on the experience, what we are seeing and observing and finding with the kids that we are working with. Just within 2 months of the parent following things strictly, speech has improved in 20%, 28% of the cases. Sleep, which is critical aspect of health, 30 to 35% of the cases, their sleep patterns improve. Sleep is a major issue in most of the kids. Eye contact improved by 50%, stimming improved by 40%. The compulsive behavior improved, hyperactivity improved, sociability, GI improvements, motor. So from all various aspects started improving as they started doing the things recommended to them. And what is that we are recommending? Good environment, good water, good food, good nourishment, detoxification, basics. If we don't do the basic, this is where the problem starts. Some of the experiences of parents after following this 1 month or 2 month plan. We have been one mother of 10-year-old female ASD diagnosed child. We have seen improvement in the bowel movement, receptive language, instruction following, speech to some extent. Another parent for a 5.5-year-old male, self-injurious behavior and hurting others is less than before. Speech has become more clear and understanding has improved. It's only enabling the body. हमको राइट कंडीशंस बनाना है बॉडी के लिए. बॉडी जानता है कि उसको कैसे अच्छे से डेवलप होना है. अगर हम अच्छा कंडीशंस देंगे, वो जो उनको सीखना है, जो करना है, वो खुद से कर पाएंगे. Another parent, he shows interest to sing rhymes. So Ayush mentioned some of these kids started singing now. Okay, they were not speaking earlier. Today they are singing because we help the parent create the right conditions for the body to grow better. Utna hi karna hai. There's nothing more we need to be doing. The moment we create the right conditions, you see, the body will start developing again. Again, the 9.4-year-old male with autism as a diagnosis, his speech has improved in the view of expression, and I would like to say 20 to 30% in clarity. Appetite has improved. Now you see, stomach is improving, the brain getting nourishment. Brain getting nourishment, the abilities are improving. Okay, so as a parent, please start asking the right questions. What is wrong in your child? Why your child is behaving or having a certain diagnosis, and what right thing you should be doing to your child. So Ayush, you can take it forward about the program.
Yes, so we'll talk about the program and what it is and what all and so on and so forth. But before that, I'll just again want to throw a small little poll to you guys so that we can understand the interest you have or inclination you have and so on. So please make sure that you respond to the poll. So we'll talk about the program and all, but I would like to take a few questions. So I have requested everyone, whosoever has a question, आप लोगों को कोई अगर सवाल है तो please raise your hand. If you have any question, please raise your hands so that we can pick up people one by one and we can talk about it. Since there are not two, and please make sure if you have any queries or interest in the program or whatever it is, then please make sure that you share your phone numbers in the group chat, so that in case you need further assistance, we can reach out to you and we can guide you accordingly. So please make sure that you share your phone numbers as well. Right, so till the point we have more questions, I'll just help you with how the program is. What is it that we exactly do, basically? So the treatment stands on 4 pillars, basically. There are 4 important things that we need to do in this program to help our children. So one is dietary changes, some restrictions would be there, some changes would be there. Second is a lot of environmental changes would be there. Role of sunlight, role of grounding, role of water, the kind of light and sound he is exposed to, place he sleeps in, how you interact with him, many things. So all of this external environmental condition for the children, So then the third point is intervention. How do we treat? So primarily we are talking about plant-based extracts or supplements or nutraceuticals. So we are talking about all natural ways or holistic ways of curing the child, whatever is wrong inside. So that is how we do this. It obviously cannot have any side effects. In some cases where we need a drastic intervention, homeopathy as well as some elements of allopathy or pharmaceutical drugs could get involved. But we try to stay away from it as best as possible. The fourth important thing is we also have internal therapies to trigger neural stimulation or neural growth. Now, some of the examples of these therapies, all of which will be taught to you. You stay at home, it would be taught to you, and you can impart with it. You don't have to ask somebody to come to your doorstep, or you don't have to go anywhere. So these are scalar, light, sound, microcurrent, quantum energy healing, many of these things. Depending upon which one is applicable for your child, you can accordingly understand, learn, and implement. Now, the entire process and approach is very comprehensive. At least we have tried to make it as comprehensive as you potentially could think about, so that you have a high degree of success in implementation. So the first thing is 4-pillar treatment, which is what we spoke about. Then there is a very strong element of parental education. There are a bunch of classes so that you learn through those classes and you are able to implement successfully. And then we make a WhatsApp group. एक WhatsApp group बनाते हैं जिसमें सारे parents, dietitian, doctors, support staff, everyone is there, so that everyone can help each other out on a continual basis, on a day-to-day basis. So there is community, there is education, and there is 4-pillar treatment as well. The way it goes is, the moment you enroll, you are given a health history form to fill in. It has some 90 odd questions. So you have to take a lot of time out to fill it in properly. And you also submit all your tests and reports to an email ID. And basis this, we do a case analysis and we order for some or advise for some blood tests. So those blood tests, either you can take our assistance or you can do it on your own. If you take our assistance, a person would reach your doorstep and would collect blood samples. Even people, let's say in Sri Lanka or wherever overseas, those collaborations are there. People have participated from Sri Lanka or whichever part of the world. Most parts are connected. So there is not a problem. In some cases where connectivity is an issue, we can send dry kits. So that is stool and urine sample you have to drop for your child, and then we can courier it back to us. Basis that, we do a root cause analysis and draw a treatment plan, which is basically a 10-12 pager or 14 pager report. These are the things wrong, and this is how we plan to correct them in such and such time frame. And Dr. Ashwini sits down with you and has a discussion through an explanatory call. Then we do have monthly realignments or reassessments to realign, and we also guide you. It's a 3-month program, 3-month online program. So we guide you what you need to do beyond 3 months also, which is why this reassessments and everything is there. Meanwhile, all of this support is available both personally and also within the community, within the group as well. So this is how this entire program is. I'll just stop here, and we'd like to take a lot of questions, hopefully. Okay, so you guys can possibly unmute yourself and you can ask the questions, please. Please raise your hands. Yeah, Sukeshan ji, please go ahead.
मैं चंद्रपुर से बात कर रहा।
हाँ, बोलिए।
मेरा बच्चा 2-2.5 साल तक ठीक था। हेलो
जी जी बोलिए।
मुझे वो अपने बच्चे के लिए प्रोग्राम लेना है
जी।
क्या करना पड़ेगा
सर? वो आप अपना फोन नंबर शेयर कर दीजिए, टीम आपको रीच आउट करेगी।
चला जाएगा। चल कोई
आप अपना फोन नंबर नीचे शेयर कर दीजिए, हम लोग पेमेंट का लिंक भी शेयर करेंगे, सब कुछ शेयर करेंगे, बट बेसिकली अभी क्वेश्चंस ले लोगों को पहले।
सर हाँ, तो मुझे एक क्वेश्चन पूछना था कि अभी वो 14 ईयर का है
जी।
हेलो 14 ईयर का है, और जैसे सिम्टम चालू हो गए थे बचपन में 2.5 ईयर में, तब वो काफी क्रिटिकल। अभी जैसे ये मान लो कुछ मेडिकेशन हुआ है, तो जैसे स्टमक ठीक हुआ थोड़ा सा, जैसे स्टमक थोड़ा ठीक हुआ, इम्प्रूव हुआ थोड़ा, बट स्टिल कंप्लीट नहीं हुआ। तो मुझे ये पूछना था कि मान लो मैंने वो कोर्स करता हूँ या ट्रीटमेंट फुल्ली करता हूँ, तो बच्चा कितने तक इम्प्रूव हो जाएगा, एटलीस्ट इंडिपेंडेंट हो जाएगा क्या?
डॉक्टर अश्विनी, व्हाट डू यू वांट टू?
Yes, हमारा कोशिश रहता है कि we do the best of the best so that a child becomes diagnosis free, independent. Yes, 100% होना चाहिए.
हाँ सर, मुझे वही मतलब वही पूछना
That's the
पूछना था.
least we can ask for. उतना तो कम से कम होना चाहिए.
Okay sir, thank you. Thank you sir. I'm interested in the program and I will definitely participate.
Hello. Hello, sir.
Yes sir, go ahead.
Can you hear me?
Yeah, we can. Go ahead.
Actually, I have one question. My child, I have a boy child who has turned 3 years this month.
Okay.
Still, he is non-verbal.
Right.
In the month of March year, we went to a child psychologist and he is diagnosed with mild ASD and ADHD. So he gave some suggestion and advice. We tried to follow it, but we could not able to follow all. So still non-verbal, but to some extent, whenever he likes to watch the videos in YouTube, he used to follow that videos, ABCD and 1, 2, 3, and to some extent he used to say, and nothing he used to say in our own language. So we want to approach you in this regard.
So do share your phone number so that we can individually guide you.
Yeah, I have already shared in the here. Yeah. Yeah,
Right.
I have shared it.
Miss Neelam Singh, Miss Divyam Singla, if you're there, please ask your question. Everyone, please raise your hand so that I can, organize this better.
Excuse me, sir. I'm Neelam Singh.
Ji, ma'am, go ahead.
And I have a girl child, 9 years old. She's been diagnosed with ASD, ADHD, and she developed F23 also. That was my psychos effect. So take the 3 months course. Is it going to help her? First thing. Second thing is kind of, and do you all provide for such kind of medicines, allopathic, homeopathic, or what? And what is want from doctor? So what should I?
Okay, so the treatment, ma'am, is based on these 4 methodologies. Diet is important, environmental changes are important, and intervention, your question, is primarily through nutraceuticals or supplements. But in some cases, depending upon child's internal condition, homeopathy could get involved. In some rare cases, even pharmaceutical drugs could get involved. So that is how it is. And the answer to your question, whether the child would be getting benefited or not. So yes, 100% he would get. I mean, we are talking about, whatever we find wrong, there is a reason why children are in XYZ condition. So we are trying to understand, break the problem into components.
And one more thing, sir. One more thing. What is the technique by which you people find out that what is the problem in the child? Is it through the blood test and the urine and stool test?
Ma'am, blood test, yes. Primarily blood test, stool and urine test also could get involved. I mean, that is just typically on, depending upon how the history form speaks about the child and how the previous tests and reports they are.
Okay, so that is the way to find out what is
Correct.
troubling the child.
So the first step is we fill in a detailed health history form. It is a very detailed form. It takes 90 odd minutes or maybe even 2 hours for you to fill it in. So the idea is we need to understand objectively how the child is from inside. Outside with the exact same reason, he might be behaving in 2 or 3 or 10 different ways, different child, different reactions. So that we understand all the tests and reports.
And I have shared my number, sir. So will I get some message in that?
We'll reach out to you shortly. Right, and I'll be sharing my number also. Anybody who wants to get in touch with me directly, I'll be sharing my number as well. In fact,
Please do share, sir. We'll
Right.
be needing your help.
Cost of the program is 16,000 rupees. If you buy for the entire 3 months, that is the cost which is applicable. Otherwise, if you break it up into components, so 20,000 ka cost. This is INR, of course. It is 20,000 rupees. The first month of which is 8,000 rupees. Then the next 2 months would be 12,000 if you break it into components. Otherwise, you buy as a package, you get a discount. There is an educational part to the program also, in which blood tests or individual treatment plan, none of that is there. But pura sari exercise, sara education, group treatment, dietary suggestions, everything is there, and that costs 7,000 rupees for 3 months. All kinds
And
of
that will be online, sir? That will be online?
Completely.
Okay.
You don't have to go anywhere. Nobody has to go anywhere. Now, one more thing I'll share. So all kinds of methodologies are there. The program is beginning on 4th of October. So before 4th of October and the beginning of program, the only thing that it means is the first class for parental education would be happening on 4th. And this is Indian Standard Time, of course. Right? So this is how all kinds of methodologies are there to make the payment. You can go visit the website, understand everything, and then you can go ahead. Otherwise, let me share my phone number as well. So my name is Ayush, and my number is 9717 333 655. So for those who are overseas, +91. All right, please unmute yourself and ask your question, please.
Yeah,
Sir,
one by one.
it will be better if you share in the WhatsApp group your number.
Yeah, WhatsApp group will be sharing. No worry. WhatsApp group, everything would get shared, including the recording of this webinar.
Your number also.
Yeah, will do.
Okay.
So, sir, Ayush, sir, I had this question on the Vim, and I wanted to know, like, whatever dietary changes or supplements that you suggest after the full analysis, for how long will the child has to be on it? Is it a lifelong change that we have to introduce to his diet, or the nutrition, or is it something temporary, or he can switch back to whatever normal diet we have it at home?
Dr. Ashwini, for you.
Oh, yes. So let's understand this. See, is there a normal means we started accepting bad food as a normal diet? Okay. Now, of course, after we improve the child, let's say it could be a 1 year period, a 1.5 year period, where we do a strict way of doing things, where the child starts learning, the problem is gone, all that. Okay. Probably he will not fall back into the trouble that today is falling back in terms of the behavior, because he has learned so much. But you see, type 1 diabetes is becoming so common today. Younger kids are having such a problem. Hypothyroidism, women having so many PCOS cases. Okay. Diabetes is becoming so common in young. So there is no replacement to the good diet. Okay. But yes, in this context of the behavioral issue, I can say once your child is away from the trouble, you can bring back the bad food. Little bit of bringing back the bad food, it should be okay. It should not be such a problem. But why do you want to bring the bad food? You should ask yourself a question.
No, let's say you are suggesting, you're suggesting gluten-free diet, or any such suggestions you have, maybe for a kid.
Yes.
So would he ever be able to switch back to, like we usually eat normal wheat flour rotis at home, right?
Right. No, okay. I'm from Punjab. I grown up with 3 meals a day with wheat rotis, but today I don't eat it because I know it's bad for me. Okay, we have to make that conscious choice. But see, it's like stomach is getting damaged by the wheat, and that damage is leading to destruction in the brain. Okay, so if I seal the brain, the leaky gut, the problem of your child will start solving. Okay. Now he will start learning, he start behaving good, all that start thing. Of course, it's a long period. It takes a while to fix the problem, right? Now, if you start feeding the bad food again, the same damage can happen. the child will develop some resistance to the wheat because the leaky gut is sorted out. But if we bring back the bad food for a full intensity, if not the behavioral issue, something else can come up, which is happening with all of us. So that you can take a call on how you want to do. For at least
So
first
does that
thing
mean
first
the
is
bad?
solving the problem.
So does that mean the bad food is all like gluten? How do you define bad food? Is it just the processed food, or is it gluten-free,
Okay,
casein-free diet?
hybrid food is bad food. Okay, gluten is wheat is largely available as a hybrid wheat that is quite dangerous for us. Kids also, adults also, elderly also, everybody is suffering because of the bad food that is gluten. Second, India is producing X amount of dairy and we are selling 3x. We are consuming triple the amount that is being produced by India. Where do you think that is coming from? Somebody sitting at home mixing some sodas and shampoos and all kind of nasty components, making milk and giving that milk to you in a packet. You
So
still
if
want to
we
consume it? That's our
directly buy from somebody's house where the milk is like from the from the cow, it's like not like adulterated one. So will that be fine?
Okay, now let's understand this. If the cow is hybridized, the protein structure of that milk from a hybrid cow is not suitable for humans. Okay, how do you control that? Then second part of the game is this milk is pasteurized. Pasteurization kills all the microbes. If a food is not getting decomposed outside, how do you expect the food to get digested within? Each food has its own microbiota. When you pasteurize it, you kill the microbes. It becomes very, very difficult to digest. The moment you find it difficult to digest, same food which should be good for you has become negative for you. Then your milk comes into a plastic package. Plastic is getting leached into the milk. You drinking plastic with the milk. That plastic is disrupting your hormones. All right. So I'm saying, today these are well-established things. The more you're careful about your child and your own self, better it is for you.
So for an ASD child, always we need to follow the gluten-free, casein-free diet.
Yes, ma'am. That is what is advised.
It's an autoimmune problem for attacking the brain. And gluten and dairy should be restricted at any cost if we want to improve the child. And I am not even aware of any other way of treatment. You might go to Ayurveda, you might go to allopathy, you might go to homeopathy. If you're feeding the problem, no pathy will help you. Nothing will help you if you're feeding the problem.
Right, ma'am. Pratibha ji, do you have a question, ma'am?
Yeah. Sir, actually, my son is diagnosed with microcephaly, which means small brain. So what doctor says is it is from the birth, so it cannot be corrected. Yeah, that is what they are telling. So all the brain, like it is not grown up to mark. That is what. But MRI and all those things are there is no issue with MRI and all those things. But functionally, he is not up to mark. He is 14 now, but with he has behavior issues and he don't understand things. Whatever is.
Right. So Pratibha, if MRI is normal, then how was the diagnosis made on the microcephaly?
With EEG.
What was the modality?
EEG.
EEG can tell the energies of the brain. It cannot say whether it's a small brain or a big
When
brain.
he was around 10 months, they have done an EEG and they told there is issue in frontoparietal region. Because of signals in frontoparietal region, he is not developing properly.
Even a child with a normal sized brain can have a poor EEG. Okay. Generally, microcephaly you can pick it up on a imaging, that is MRI, right? Again, there's another part of the game is Nothing is permanent in the body. Okay, there's something called neuroplasticity.
Yeah.
We always keep developing new connections in the brain. Nothing is permanent. You can always help your child. You can always help yourself. Okay, nothing is that we are born with a problem or something is fixed. You start creating the right conditions for your child. The body will respond.
Mr. Sabir Mahmood, the person with the name Nepal. If you're there, please unmute and ask your questions, please. And then after that, Ms. Zara Zen, and after that, Mr. Tapal. Person with the name Nepal and Mr. Mahmood, you're there? No. Ms. Zara, if you're there, please ask your question.
Yes, thank you, Ayush. Doctor, what sort of alternatives you would recommend for, say, for example, for casein intolerance? My son, he loves his cup of tea. And unfortunately, all of us at home also. I've been having a hard time trying to get him off his milk. Gluten-free, of course, going over to rice and organic rice.
Zahara?
Sorry?
I could not hear what you're saying, madam.
You can't hear me? All right. Is this better?
There is a lot of disturbance. If you can type in, basically.
Okay, I'll type.
Mr. Tapas, please go ahead. Ask your questions.
Yeah, doctor, yeah, my child is 3 years old, okay. Actually, he doesn't want to drink water. So we used to feed him non-raw mixed with water, warm water. And recently, for the last 3 months, we are mixing non-tree and cow milks. What is available in our area? That is a local breed cow milk. Then what is the problem lying behind? He doesn't want to drink water.
Okay.
Only a few with droppers we used to feed him.
Tapas, you're taking your child under sunlight?
Yeah. Sometime we used to go out.
No.
Whenever, in a hot sunny day, used to drink water only.
Let's understand this part. You go under sunlight. Can you live without water if you're dehydrated? If you're under sunlight? We humans are built to be under sunlight. Okay, but today we have changed the equation. We are always inside. We are trying to go against our nature, and when we do that, there's a trouble. So what you do, you take your child every day under sun, he'll start drinking water. Sometimes things are very, very simple to tackle.
Okay. And doctor, is it possible to give him cow milk? Is it suitable?
So
Normal
again,
cow milk.
so many things are there which could be wrong with the milk. Your child's ability to digest depends on the bacteria that is there in the child. Today, as a humanity, we have lost 35% of the diversity of the microbiota. 35% अपना बैक्टीरिया चला गया है. उसके साथ अपनी बहुत सारी abilities to digest certain foods has gone. और जब हमारा ability नहीं होता है and we feed those food, that same food could have been good for us has become negative for us. So we have to be very, very careful, guys. Okay, don't get stuck to the old style of living. The environment is different. Situations are different. Today if we have to be healthy, we have to go by today's situation. We cannot apply something which was in the past.
Mr. Tapas, please do share your phone number so that we can reach out to you and we can, specifically and in elaboration can answer you.
Okay, thank you. I have shared already. Okay, I'll talk.
Miss Mariam, you have a question, please unmute and ask your question. Mrs. Subrata, if you have a question, please unmute and ask. Mohammad Shabir, Mahmoodji, Miss Nuzra, please go ahead and ask your question.
Hello, sir.
Yes, ma'am, go ahead.
Hello, sir. My son is 7 years old and he's diagnosed with ASD.
Okay.
He has some concentration problem is his most problem which we are overcoming with. So he has learning difficulties, like how can I help him when it comes to learning difficulties? He
I tell you, Mariam, sorry, Nusra. Let's understand this. Our fundamental unit of the cell, which is the energy house, is the mitochondria. Each cell has 500 to 5,000 or 10,000 mitochondria. एक सेल में 10,000 माइटोकॉन्ड्रिया हो सकते हैं और नर्वस सिस्टम के माइटोकॉन्ड्रिया सबसे ज्यादा होते हैं.
Okay? Excuse me, sir. I am from Sri Lanka, so I don't understand Hindi.
No problem. So yeah. Each nervous system has the highest number of mitochondria. All right. Okay. And if mitochondria is working well, the body will function well. The abilities, the cognitive learning abilities, all the abilities will be fantastic if the mitochondria is doing a good job. What can damage the mitochondria? It could be toxins. You take a vaccine has aluminium, vaccine has mercury into it or some other toxins into it. That toxin can get into the mitochondria and damage the mitochondria. Your abilities are reduced. Your body don't have enough proteins, your mitochondria is not getting enough nutrition, your abilities are reduced. You are under blue light all the time. You're under Wi-Fi all the time. Your mitochondria is damaged, your abilities are lost. You don't hydrate your mitochondria. There's no enough water in the mitochondria that can reduce the ability to function better and reduce the capabilities of the brain. You don't go under sunlight. You don't make your own water. Just like plants take the water and the CO2 make the food, carbon. Okay, we make our own water under sunlight, red light. Okay. You don't take the child under sunlight, the child don't make its own water, mitochondria is dehydrated, does not function. Sometimes things are simple in a way if we do the right things. But if we don't follow the right path, then we keep going into the circles, but we never get to a solution. Yes, we can help your child, definitely.
He's under medication, sir. Like I have to give him some pills to keep him under control.
So, Nusra, the medicine that you're giving is only a symptomatic. If he's hyper, you give her something to calm him down. Why there's a hyperness, you have to fix that. If you fix the problem, you don't have to give the medicine. But if you don't fix the problem, over a period of time, you keep increasing the dose of the medicine, but your problem will still there.
Yeah, sure, sir. So, sir, can I is his problem can be solved, or how long should I have to get him medicines and medication?
Let's understand this. Brain can take 6 to 8 months to rewire itself. Okay. So at least 6 to 8 months, we have to do a very, very hard work. That's one. Second, this program is a 3-month program. In 3 months, you will see a change. You will see a positive change, improvement in the child. Could be 30%, could be 40%, depending on how severe is the problem in your child. Okay. Now, after 3 months, we have a continuity plan. But as a parent, you understand a lot of things. Today, I'm telling you new things. In this program, you will understand a lot of things you have to implement. You have to become a doctor for your child. And you have to implement those things. And you do that, your child will slowly start improving.
Sure. Sir, how do you believe in occupational therapy? Is it helpful for my autistic child to overcome it?
Right. Let's again, I give you an example. You have a car with a punctured tire. Okay.
Sure, sir.
You have to fix the puncture rather than you put another engine on the car. Okay?
Yeah.
If you don't fix the problem, then whatever therapies you keep doing, they might be helpful, they might not be helpful. But if you fix the problem, the same behavioral therapy will become much useful.
Sure. So then your conclusion is like it has to be his nutrition should be settled. Is it so, sir?
My body is made of the food that I eat, kind of lighting that I am under, kind of water I drink. Right? This is a fact of the matter, right? If I don't feed myself with a good fuel, how do I make good cells in the body? How do I make new connections in the brain? So
yeah, sure.
This
sure,
is a
sir.
bizarre thing in the conventional medicine, that we say that food has no connection to the body. Our
Yeah,
body
sure,
is
sir.
made of the food.
Yeah, sure, sir. I believe on it because, sir, like when I give him some fast food or anything, then I feel like he behaves more violent, and so I believe you, sir. Yeah.
These 4 things, sir. I mean, it's not just diet; it's all of these things collectively coming together, and
sure.
we also have to have the other things, So we have to have education so that we help you, as Dr. Ashini said, become a doctor for your child. So you have to have the education, the whys and hows and how-tos of whatever needs to get implemented. And then parent-to-parent communication and that kind of a thing is also very, very helpful, because a lot of things that a doctor may or may not be in a position, or the entire staff may not be able to understand very well. Another parent would, in a much better way. So they can give you the tips and tricks to implement certain things, which for your child might be becoming a little tricky. So that is how we have designed this program.
Sure, sir. Thank you, sir.
Thank you, ma'am. A lot of you have still not responded to the polls, so please make sure that you do so. If you are interested, yeah. So, sir, there are a few questions in the group chat.
Yes, Bhavna God has a question. Bhavna, you can unmute yourself and ask the question.
Yes, sir. Sir, my son is 3 years old, and like earlier, he used to watch so much of mobile screen language, and suddenly I saw that he sings only the rhymes and all. But now, when I cut him from the mobile, now he starts speaking, but little bit of speaking, and like he's doing activities
100%.
also. So I want to know
Right.
that whether the problem is of speech delay or it is related to something like autism or ADHD.
Okay. See, diagnoses are made on the basis of symptoms. Autism, for example, repeatability, social behavior, and speech. Okay. Similarly, ASD, ADHD, different diagnoses are made. Now, you've
I
made a
have
very
been, yeah, please, you continue.
okay. So I'm saying, don't worry on the diagnosis. What your child don't even try to put them into a category of this diagnosis, that. Let's try to find what is the problem. And you mentioned a very, very valid point. See, there are 2 parts of the brain. One part is linked to the speech. One part is with the memories, with the visuals. Now, if your child is always on the phone, the memory and the visuals will overtake the speech. Then your child will not speak. The moment you taken away the phone, he is not getting so much into the visuals and the memory. He starts speaking.
Yeah.
So rather than putting them into a diagnosis, we fix the problem. Why it is happening, which is more important.
Ms.
Okay.
Rajasinghe, if it is possible, please unmute yourself and ask your question. Bhavna ma'am, your question is answered, I suppose.
Yes, sir. Thank you so much.
Thank you. So there are a few questions. We have given 2 doses of MMR vaccine already, but doctor recommended 3rd dose also. Is it necessary? So that I suppose you have to ask your doctor. So the pediatrician.
But Ayush, I can mention that MMR has a correlation with causing these troubles. Okay, so just because you want to prevent an infection, but you infect with the dead virus and the bacteria, leading to such a problem. So just be careful, guys. Don't overdo the things.
Right. So Mr. Anirban wants to understand: is the diet also going to be soya free?
largely available soya that is there in the market is hybrid, and hybrid soya can really disrupt the hormones. Yes, if you get a non-hybrid soya, you can feed them as much as you want and it will be good for them.
Is yogurt good or bad?
Okay, so then there are nuances to it. What is it made of? Yogurt is a generic term which is a fermented food, generally from the milk, but it doesn't say which bacteria it has. What is the source of the milk? Okay, so if you buy a good quality A2 milk, you ferment it well, there is no undigested protein left into it. All right, it should be fine. It should not be a problem. But if you buy a market yogurt, which is pasteurized, basically, which means because to increase the lifespan of the shelf life of the yogurt, they make the yogurt in a very, very quick way. They don't really ferment it. And after fermentation, they pasteurize it. That yogurt will not have any good microbes, but they only have broken proteins, which can be reactive. So there's no simple answer to that, but of course you get the gist of the problem.
Right.
Hello, doctor.
Yeah, go ahead.
Yeah. Yes, I'm Mrs. Dayananthan from Sri Lanka. This is on behalf of my son who's 6+ old now and diagnosed with ADHD and ASD very recently, say like a couple of months before. So which is like he's prescribed with Ritalin tablets, but though then I didn't start it yet. So is it something like that? If I start with, if I really would like to introduce him the tablets, say like to give a try for 6 months with a course of yours parallelly, both together, and if I think of skipping away from the medicine, is that the child is going to get addicted to the medicine?
See, what the medicine is generally, it's a suppressant. Okay, your child is hyperactive because of certain reasons. Reason could be fungal infection, could be clostridia, could be toxins, could be anything, could be technology. Okay, now you are only using a suppressant to suppress it. You are not solving the problem, but we are trying to solve the problem. So till the time the problem is sorted, if there's a hyperactivity in that period, you can use a tablet to keep him calm, and it is easy for you to implement what we are recommending. And as we go on this path, the need of the drug will be less and less and less, and eventually you can stop the drug because the reasons of the hyperactivity will be taken out from the equation.
Okay. Okay, so I mean, like expected side effects of these tablets are, is it like that would usually the children tolerate? Is it?
I don't
as a mother,
prescribe.
I'm
I
unable
don't prescribe. I don't prescribe them the tablets. I help them get out of the tablets. Okay.
Okay.
So tablet is only a symptomatic relief for some time. Of course, it will have its own side effects. Okay, but fine. I mean, for a short period of time, as long as we're trying to fix the problem, it should be okay, right? So don't worry on that part. But I cannot comment on the tablets because I'm the one not doing it.
Okay. Thank you.
Miss Jennifer, if you can unmute yourself, please ask your question directly, if it's possible. Jennifer's daughter is not eating well, but she's used to cow milk and Horlicks. If she skips that, she doesn't have the energy and so on. So alternate almond milk is good, but again, the package is almond powder is processed. So how do we solve this?
Right. So one thing to understand, the casein in the milk, the gluten in the wheat are addictive in nature. Sugars are addictive in nature. Horlicks has a lot of sugar. Horlicks has a lot of plant oils, which are very, very unhealthy. Horlicks is an unhealthy product. Okay. The child get addicted to it, and addictions, just like if I'm on drugs, I'll get addicted to it. I'll only ask for that same thing. Okay, so slowly we have to the something which is addicted, you'll take them away and start feeding the right things. No, energy wise, the mitochondria is not functioning well. When the mitochondria is not functioning well, it is not converting the food into the energy, and the child is low on energy. Our whole purpose is to improve that energy production. Now, as the energy production improves, the child will have energy as they should be having as a child.
Right. Anybody else? Any other questions? If you haven't shared your phone numbers yet, you have any interest in the program or queries or whatever, then please go ahead and drop your phone number, including you, Miss Jennifer, if you are interested. How to correct gut bacteria. I mean, I answered Ms. Tarangi. Again, I requested you to unmute if it's possible. So diet, environmental changes, and the treatment, which is intervention if required. So if there are any kind of infections,
I can answer that, how to correct the bacteria. So the kind of food we eat, kind of bacteria we grow, kind of lighting we are under, kind of bacteria we grow. You have a washroom which does not have sunlight, you will see fungus growing on the walls. You don't seed the fungus just because in the poor light, the fungus will grow. You take your child under sunlight, the child get what it needs to have, he'll start growing good bacteria. Okay, you feed the child with diverse fibers in the diet, the child will start growing good bacteria. That's one part. Second part, of course, if there's fungus, there's clostridia, there's unwanted things, we can use some herbal or non-herbal things to kill the bad guys. We can use probiotics to improve the good bacteria. There are ways. So of course, it has to be done very, very systematically. It cannot be randomly done.
yes, definitely. I mean, homeopathy or Ayurveda or any other therapy or any other such thing, if you are doing, it does not intertwine or intervene with the either. It basically helps the other. So anything which is holistic in nature, you can definitely start alongside with homeopathic medicines. So that's not a concern. Anybody else? Any other questions? People who are in Facebook and watching us, basically, if you have interest, अगर आपका interest है या आपका कोई सवाल है जो कि unanswered रहे हो, तो please make sure कि आप अपना phone number share करें हमें. Please share your phone number in the chat on Facebook. And if you have any questions, please share your questions so that we can take those questions and address them. So we are about to close the session. I hope the session was useful. I hope the session was encouraging. I hope that you have hope. So basically the point is at the end of the day, autism, ADHD, GDD, all of these things, at the end of the day, they are collection of different kinds of symptoms. There are 14 different or 12 to 14 different parameters that we are continuously tracking. Subrata, I'll come back to you. So there are 12 to 14 different parameters or symptoms that we are tracking, such as hyperactivity, hypersensitivity, gut issues, sleep patterns, speech issues, receptive understanding, stereotypical behavior like hand flapping, rotating, toe walking, those kind of things, aggressiveness. All of these different kinds of symptoms are something which needs to be understood individually. Autism cannot be treated by a medicine simply because whichever kind of medicine it is, it cannot be simply treated as a whole by a medicine, whether it is homeopathy or Ayurveda or whatever, is because we don't fully understand what that problem is. So the only way to understand the problem better is we break it into as many components as we can and individually understand what is the problem behind why my child is swallowing. What is the problem behind why my child is not able to speak very well? So that is how it is. So yes, Subrata, Mr. Subrata, and then Miss Anita, please ask your question. Unmute yourself and ask your question.
Good evening, sir. Can you hear me?
Yes, please go ahead. पूछिए सर.
लड़का है वो उसका 4.8 years old है and he is diagnosed with ASD. तो एक्चुअली उसका पहले गट इशू भी था, कुछ सेंसरी इश्यूज भी थे और टेंड्रम थ्रोइंग था, तो वो सब स्टेम सेल उसका हुआ है, स्टेम सेल थेरेपी जो होता है वो हुआ है। उसके बाद से वो इश्यूज एकदम कम हो गया है, वो बहुत शांत हो गया है अभी, लेकिन उसका अंडरस्टैंडिंग लेवल उतना नहीं है कि जैसे कि उसका एज पर डायग्नोसिस 1.5 years back. सो मेरा मेन जो कंसर्न है, सो इस फंक्शनल मेडिसिन के थ्रू उसका ये अंडरस्टैंडिंग कुछ बेटर हो सकता है, जबकि उसको पढ़ाई में या दूसरे चीज़ों में उसको वो चीज़ समझ आए, क्योंकि अभी उसको उतना वो समझ नहीं आ रहा है। जैसे कि उसको प्लेग्राउंड में मैं खेलने ले जाता हूँ, तो वो कैसे खेलते हैं वही चीज़ उसको मैं सिखाता हूँ, लेकिन वो समझ नहीं पाता है। मैं बहुत ट्राई कर रहा हूँ, लेकिन उसको वो समझ नहीं है। दूसरे बच्चों के साथ कैसे खेला जाता है उसको दिखाता हूँ, उसको वो प्रोसेस में डालता हूँ, दिखाता हूँ, लेकिन वो चीज़ उनको एकदम समझ नहीं आ रहा है। उसको जब पढ़ाने का टाइम में भी वही चीज कर रहा हूँ, तो वो भी नहीं
सुब्रता जी,
सॉल्व हो रहा है।
डेफिनेटली बच्चे का कॉग्निटिव एबिलिटीज इम्प्रूव होएगा। Okay. So yes, Subrata, the child will improve in the cognitive abilities, 100%.
कोग्निटिव एबिलिटी का मतलब सर है ये कि सोचते समझने रेसिप्रोकेट करने की क्षमता, चीज़ों को समझना और उस हिसाब से रिएक्ट करना, वो डेफिनेटली इम्प्रूव हो। देखिए वही सिंपल सा जवाब, मतलब सारे सवालों का घुमा फिरा के आपकी जो प्रॉब्लम है उसको हिस्सों में तोड़िए। उसको हिस्सों में तोड़ने के पीछे जब हम जाते हैं तो उसके कारण दिखाई देते हैं। उन कारणों को रिजॉल्व करेंगे तो वो जो इश्यू है वो इश्यू खुद ब खुद इम्प्रूव होता है, और सब कुछ सही चला तो पूरी तरीके से रिकवरी भी हो सकती है। तो ये सब होता है, और these are the examples we have shared with you in the beginning. So definitely they are. Miss Anita, please unmute yourself, ask your question.
Sir. Hello, sir.
Hello.
Yeah.
I am Anita's husband here. I'm also, my son is 6 years old. We are from Sri Lanka. His biggest issue is verbal stimming, continuous verbal stimming, even during his classes. And I would like to know whether there are any specific things that could be addressed from this program or this course of medication. And also, since we are from Sri Lanka, how can we get the necessary tests done to identify specific problems? Thank you.
Right, sir. So I will answer the second question first. So necessary tests, for example, heavy metals is a big problem today. So we will get a hair sample done. Hair sample analysis will done in Poland. We'll send the sample to Poland. So certainly we can ship the hair sample to Poland from Sri Lanka and get it done. Second, we use a dry kit to get to know about the nourishment, also about the gut microbiota, which is also one of the reasons behind the stereotypical behavior. So that kit we can send you from India. From India, it will go to Mumbai. Mumbai, the lab will test it and give you the report. Yes. And some tests we will also ask you to do locally in Sri Lanka, which is like vitamin D, thyroid function, liver function, kidney function, certain inflammatory markers, which you can do locally in the labs in your city. So
Right.
we help you to get that done.
So there are people who have participated from Sri Lanka in the past, so it has been coordinated. So we can definitely help.
Thank you so much.
Right. Thank you. Make sure that you leave your phone number so that we can, in case required, we can guide you, reach out to you.
Surely will do.
All right. There was one more person. So yeah. So ye sawal again. I think the person is from Sri Lanka again. So correlation between ASD and convulsions, seizures.
Right. So convergence is an inflammation.
Excuse me. Sorry for interruption because I was waiting since very long that you will give me chance to talk also. If you don't mind, can I ask the question also, please?
Yeah, please, madam. I call you out in between. I thought you are not there. Sorry. Please go.
Okay, sir. I am currently living in UAE, and my question is: my son is 6 years old, and he is diagnosed with a mild ADHD and speech delay, like no autism and nothing. So I was hearing your presentation. You said the main cause of speech delay is some vitamin, something like that. I didn't hear that the name of that vitamin. Is that available in any natural food or something like that, or we need to get it supplements or something? What
Right,
can we do?
right, madam. I tell you. So generally, what we see into our practice is a serum creatinine when it is low. It is associated with speech delay. Now, it's amino acid. It could be, yes, proteins are there in the food if we eat good quality food, but at the same time, we should be able to digest that food. When we don't digest, the food does not become part of the body. This is where deficiency starts. So we give them a protein powder, which is pre-digested. It is already digested. It becomes easily, quickly becomes a part of the body, and brain gets nourishment. That's one. Second, of course, a technology. If your child is always hooked up to technology, that technology is causing speech delay and ADHD. So
I 6 months back I actually cut him off from the technology completely, and then actually he started talking now, but not like a normal 6 years old kid. Only he can tell about his basic needs.
Yes, Mariam, it takes 6 to 8 months for the brain to get rewired.
Okay, I want your program, like I want to register for your program. How you will actually coordinate with me in UAE if I want medicines and something like that? How we will do that?
Amazon, everything is available, madam.
Okay, so I will drop my number there in the group, sir.
Sure, 100%.
So he needs the medication, right? Because over here they didn't give him medication. They just give him some vitamin D and omega-3 drops, something like that.
Okay. So basically, we will do a very, very thorough testing. Okay. Based on the testing, we'll prescribe what is missing in the body.
Okay. Sure. Please. Thank you so much. Now you can continue. Sorry, huh?
No. Your question is why we are here.
Thank you so much.
So I've shared the details of payments or program details or website and all of that. I just shared. So those of you who want to have a look into those kind of things, please go ahead. Mr. Rajaprathinam, it would be difficult to pronounce his name. Please go ahead, sir.
Hello, sir. Tamil Nadu, coming call from.
Please go ahead,
sir. Sir, my child 10 years old.
Yeah, 10
Hello.
years old child.
10 years on the old. Saddle mouth. So saddle. Echil Tamil language, sir.
Tamil.
Delay speech, no autism.
Delay speech.
Delay speech.
Right, so
mouth. Mouth on the slow running. Hello.
Slow running.
Yes, slow run. Yes, I mentioned the reasons behind.
Hello, sir.
Yes, sir. I am saying I talked about the reasons of the speech delay.
Yes, speech.
Right, sir. So yes, we can help the child get better. Yes, certainly.
Sir. Hello.
Yes, Raja. Yes, Raja.
Raja Pradeepan.
Please go
sir,
ahead.
Raja Pradeep.
Raja Pradeep ji, please.
Right. Raja Pradeepan.
Saddle, HL mouth, HL mouth. No writing, no speech. Delayed.
Right, sir. I think Raja Sipan, yes, your child, we can help him to get better. Yes, certainly.
Okay, sir. Okay, sir. Sir.
Right. So Mr. Sabir Mahmood, अगर आप हैं वहाँ पर तो please unmute करके अपना सवाल पूछें. So
Sir, your contact number, contact phone number.
yeah, my number is my name is Ayush. My number is 9717 333 655. आप लोग मुझे reach out कर सकते हैं. You can reach out to me on this number. Okay. And please make sure that Raja Pradipan ji, please make sure that you have shared your phone number also, so that I can save it.
Okay, sir. Okay, sir. Okay, sir. Thanks, sir.
Okay. All right. So that's about it. Anybody who still wants to share their phone numbers or anything of that sort, please do that. If you are not responded to the polls, please do that as well. And I've shared my phone number again recently, so that's the last message in the group chat. So please pick that number from there, and we will have to have a discussion and help you and guide you and help your child become better.
Okay. Okay, sir. Medicine improvement or the autism child.
Supplement, sir. Supplement, diet, environmental changes, water change, light change, like that.
Fever achievement. Okay,
Right.
sir. Okay.
Correct. Sorry.
Okay. Thanks, sir.
ASD versus convulsion. The person is not.
Okay. Okay, so let's understand this part. Convulsions are caused by inflammation in the brain. The same inflammation can cause ASD. Okay, so they're connected.
Sorry. Language and the problems. Okay.
Right, sir.
Ms. Roshna Dilipa, I don't know if you're listening to this, but is your question answered? Please type in or unmute yourself and share your thoughts so that we can close the session. We are waiting for your affirmation basically. Others, one last question. What is the nutritional supplement we can give? So it depends upon how your child's situation is, condition is. We need to individually assess and understand and so on, and thereby guide on nutrition. There is absolutely nothing which is generic. Generally, what we can suggest is something which is clearly bad, avoid that. And that is what we have been thoroughly discussing in the webinar. But what is good is something which the child is lacking in. So that is something which needs to be understood better. Right? All right, Bhupinder ji, आपका कोई सवाल है क्या? Sir, if you want to, you can probably leave because it's already delayed.
Okay, thank you so much, guys. I hope I was useful to you guys. Thank you so much. Thank you, Ayush.
Thank you, sir. Thank you so much. So, Ishra. So, Miss Ishra, can we do the tests in Sri Lanka? What are the tests? So there are a bunch of tests. What tests we need to get done? So there are a bunch of tests. Oh, hold on a second. If that screen is there, I'm not too sure if the screen is there. 1 second. I think that screen is there. It's not there. So there is an array of tests. So there is a list of some 20-25 odd tests basically, of which not all are required. Only the ones which through your health history form and through your basically your previous tests and reports and your symptoms and so on, we understand are necessary. We don't have to go for a lot of tests, just the ones which are necessary. Primarily what we are trying to understand is heavy metal toxicity, gut microbiome diversity, metabolites, hormones, enzymes, the current functionality of your mitochondria basically. So that is all that is there. Yeah, we'll do that. Ishra, don't worry about it. You just drop your phone number. We'll reach out to you individually also, and we'll guide you thoroughly. Don't worry about that. In case you haven't shared your phone number yet. Medical insurance, yes. If all of you, this is important. So in case you have a medical insurance which covers OPD, which is for consultations and so on, then this program would be having no cost to you. So for a lot of people, this is covered under, OPD is covered under your insurance, especially if you have a corporate insurance, and also a lot of people do avail that. So cost may not be that much of a concern if you're working in a large firm. Cost is, the cost of the program is 20,000. If you buy the entire thing, Shashi, which is 3 months, then there is a 20% discount, which is 16,000 would be the landing price. Bhupinder, there is a educational part to the program also. What we want you to do before you join as a team and so on and so forth is basically go through that education so that you are fully aware of what to do and how.
Excuse me, is like the medical reports also included or excluded from this package, sir?
Excluded, ma'am, because every child is going to have very different tests.
So depending on the issue that like I say, you request me for the medical reports, is it?
Correct. Either you can get it done on your own, or you can take our assistance so that it becomes a little easier. It comes to your doorstep and all of that. Sri Lanka, it won't. I think you're from Sri Lanka.
Yes.
But then we can help you get coordinated and so on. So there are people who have participated in the past from Sri Lanka.
Okay. Yeah.
So if required, we can help you get connected and so on, so that you can understand.
Yes, please. I have dropped my contact details. Please.
No problem. We can help you get connected so that you know. And it's a little trickier. It's a little. It takes a few more days, but then the process is there. The mechanism is there. So all of that is done. No problem.
Okay.
Right.
Thank you.
Thank you, ma'am. Miss Jennifer, you raised your hand recently. Please unmute and ask your question. When is the deadline to pay? The sooner you pay, the better it is, because your treatment begins.
Actually, this is Jennifer. My daughter done a surgery in 7 months, cleft palate. Actually, they have given an anesthesia in that time. Because of that, is any chance of ASD?
No, unless basically, this is not the age. First of all, why we cannot, with a high degree of certainty, say this is the reason why your child got ASD or got into ASD. Because first of all, there is no way to, with a high degree of certainty, even define what ASD is. Nobody can define exactly this is what ASD is. Subjectively, there are some 12-14 symptoms, of which if your child has certain number of symptoms, it is or he or she is categorized as ASD. And also they have IQ tests and other things. There are several other tests, CAST as this, that. So all of that is there. But all of this is subjective, because your child would be responding in a different manner, let's say today, and compared to if the test is taken after 4 days, would be a different score, different everything. So all of this is subjective. Now, something which is subjective is very difficult to understand and cure. And same with the case, why she got it. Because we don't know what she got. And it's very difficult to pinpoint this is why she got it. But there is a list of reasons, basically, which doctor shared earlier. I'll share that with you again. Give me a second here. Yeah. So these are a bunch of reasons because of which children get into developmental disorders of any kind. Right? This list is not complete. Okay, all of these reasons, there are more. So maybe at the time when anesthesia does not cause anything, by the way. But when anesthesia was given, there could be certain other medications which could have screwed up with the liver and in turn the entire endocrine system, and could lead to dysbiosis and SIBO and so on, and finally leading to autism. So that could be a possibility. Medication, not anesthesia. That could be a possibility. Heavy metal toxicity could be a and the reason why the child went into anesthesia was some surgery, I suppose. At that point of time, if some infection happened, or maybe before or after that, that again could be a reason. So a bunch of reasons, as you can see.
Thank you, sir. And you also said that about root crossing and root causes. In which way they will diagnose that?
Blood tests.
Sorry?
Blood tests. We are trying to understand metabolites,
Okay,
different kinds of toxins, hormones and enzymes, their balance and imbalance, micronutrients. Then we are trying to understand about heavy metal toxicity. So like that, there are a bunch of factors that we are trying to understand. Cellular dehydration is yet another one. Mitochondrial imperfections is another one. So like that, I mean, depending upon when you fill in the form, we understand about your child, and accordingly we advise for certain blood tests.
Okay, sir. Dhanyavad.
Thank you, ma'am. Please do share again your phone number in case you haven't. Can you just mention approximate amount for tests? See, the minimum cost for the test would be in Indian rupees, would be 5,400. That's what, I mean, that is through us, because obviously if you go outside and get it done, it would be much more costlier usually. The reason is whatever referential amount that we are getting, we are completely passing on to you, which may not be the case until unless you know the lab people. So 5,400 is the minimum, and maximum could be anything. I mean, depending upon if the parents are crazy about going for different kinds of genetic testing and this and that, it could go into lakhs. But then usually it is around 8,000-9,000 like that in Indian rupees. Mr. Raj Prati. Anyways, okay. Any other questions remaining? Can you mention the? Can I get a reference of people? Yeah. I'm playing. Yeah. Dr. Ashwini is based out of Bangalore anyway. Okay, please send phone number of people. Yeah, Sri Lanka. We'll connect, no problem. Then again, for we have an Bhupender educational program. आप अपने number छोड़ दिया है, तो आपको बताएंगे कैसे क्या है. No problem. Medical insurance, please make sure whoever is thinking about joining the program, please make sure that you talk to your insurance person and just check with them if OPD is covered. If it is, maybe the cost, there would be zero cost to you. A lot of people, they do that. Even in Sri Lanka for that matter, maybe the cost is zero. I don't know how it goes in Sri Lanka, by the way. I suppose we are done. We are still getting questions. Yeah. That's all. So nothing else from my end. Thank you for your time, and we'll speak to you soon enough. Thank you. Anita, that hair test for heavy metal toxicity is it's sent to Poland because it is cheaper and better. In India, the cost is 19,000. In Poland, the cost is 5,000. Poland, the cost is much lesser. Anybody else? I'm trying to disconnect basically. I don't want anything to be unanswered. Thank you. Thank you all.